Thanks very much, Cathaoirleach. I want to welcome Minister Stephen Donnelly to the House, who's here to take this debate. And I see Minister Eamon Ryan is here as well. I want to speak about this latest lockdown, and as a TD that represents Limerick City, and the impact it has had. And I want to make a number of observations that I hope will feed into government policy on this area. Number one, Minister, I want to know what exactly is the government's policy on fighting COVID-19. Is it a lockdown and release measure, or which is containment, which I believe is what we're doing at the moment, or will it be a measure where we look to live with the virus? And government have stated that the policy will be based around that we'll wait until a vaccine arises. For me, by definition, that means you're looking to come with a policy which is living with the virus, which is one I would support. Secondly, we need to see what is the exit mechanism for this current lockdown. What are the metrics you're going to use? The public are entitled to know. And if we want the public to support this current lockdown, and I believe buy-in would be much harder than the first lockdown. First lockdown, the circumstances were entirely different. We had a major pandemic had literally broken out in Italy. The public's attitude at that time was very much we had to deal with it head on. We are now in a situation, it was coming into the spring period, we're now coming into the depths of winter, and we need to look at it in a different way. So, Minister, I want to know what's the process by which you're going to indicate to the public that we exit lockdown. I understand it will be you have to look at 2 incubation cycles, which is 2 weeks, which is 4 weeks in total, 2 weeks each. And then you would look at that the R rate is below 1 and that there is a reduction in the number of new cases. NEFID have come out and they're speaking about 0.5 below that. What is the government's exact position? This is what the public need to know, and it must be, in my view, realistic. If the virus rate is coming down, and I welcome the fact that it's done now in a district electoral division, we can get it every week. People need to know what's working. We all want to fight the virus. The problem at the moment is that many of the public believe that some of the measures that are being brought in, from a risk viewpoint, will not assist in reducing the spread of the virus. So those need to be explained. Issues that have arisen there, closure of golf courses, the closure of gyms, the stopping tennis being played. So what I want is, Minister, what is the exit mechanism, strategy? People need to see a light at the end of the tunnel, a realistic light. Then what will the metrics that will be used to indicate to the public that we can exit lockdown? Are we going to level 3? The last lockdown had an enormous impact across the various people in the communities, more particularly the elderly. I fear that many of them will find it impossible to come through this lockdown. There needs to be support put in place, isolation, not being able to exercise in the normal way that they once would have, going up to town, meeting their neighbours. Day-to-day things that we take for granted that lockdown prevents. And we need to look at that cohort. Mental illness, the impact it's having on students, which is an element, an area, I suppose, a period of their lives, which should be a very exciting one, which has now become one where they've distant learning. You made reference to it yourself in Morning Ireland. It's something I feel very, very strongly about. And Minister will appreciate, I work in metrics. As an accountant, I want to see discernible results, risk-based analysis. So for the next 6 weeks, and the WHO have come out and said, for the next 6 weeks, we need to get our positions straightened up, whereby we can come out of lockdown and live with the virus. We don't know when a vaccine will come. By definition, then we have to live with the virus. So what measures are we going to put in place over the next 6 weeks, apart from lockdown, which will hopefully stop the virus spreading, but it's a very crude way of doing it. I would like a more sophisticated way of doing which is risk-based, which allows us to live with the virus. Businesses are closing. You have many family businesses out there that may never open again. You have businesses that set up that are struggling. And I speak to the business community on a regular basis. I come from that background myself. They're realistic. They realise that there is a requirement to bring in measures now. But what they want to see is, what are the metrics? So as weeks and days go by, that there's an indication the rate is coming down. And it's looked at on a county basis, on an electoral area basis, looking at analysis being done whether specific sectors bring risk, some do not, and in a very evolving way. So that when we come in 4 weeks' time, hopefully the R rate will be way down, well below 1. We'll have a decreasing number of rates. But what are we going to do over the next 4 weeks that ensures we can come out of lockdown and live with the virus until a vaccine is found, whenever that is? And that, in my view, will require, what's our capacity in the hospitals like? Is our ICU capacity sufficient? At this moment in time, are the level of staff we have in the health sector sufficient? Do we need to look at what's our contact tracing like? And certainly, Minister, you will appreciate over the last few days, what has happened has brought into question the public's belief in the system. There are fantastic people working in the HSE, in contact tracing, and otherwise I deal with them on the ground. They're working, as you say, 7 days a week. But the question is, for us to get on top of this virus, we must be aggressive, we must be working collectively at every level, government, departments, the public themselves, and the basics still apply. I agree with Mick Barry on very little, but he made reference to about the basics: wearing a mask, staying 2 metres distance, protecting the vulnerable in terms of people that are old and the elderly. And I'm very, very conscious of the elderly. I worry, Minister, over this 4 weeks, and many of them will be isolated. It's hugely important that extra resources are put in to make sure that they're all visited, if not by family, by the services. That every possible, that we look at the mental health side. But what I want to see is over the next 6 weeks, what have we learnt that we can now put in place that come the start of December, we're telling the public we're coming out of level 5. What level are we going into? What are the metrics we look for so that we can go to the different levels? And I think it's important that there is a meeting of minds between government and NPHET on these issues, because everyone should be working in the common interest for the public. I'm a TD, first and foremost, for Limerick City constituency and for the people I represent. And I wanted to make a contribution to this debate, so therefore it would feed into government policy. So, Minister, what are the metrics you're going to use to indicate to the public you're exiting lockdown? What is the government's policy on COVID? Is it a policy of lockdown release, or is it a policy of which is containment, or is it a policy of living with the virus? Is it an evolving policy? What will you look for so that you do not have to go into specific areas lockdown based on metrics, based on the R rate being a certain rate, based on the number of cases being? So, and if the cases are coming down, that the public will see that there's a benefit to them, ultimately, with the rate coming down. Because for many people out there who were exceptionally law-abiding, took huge level of restrictions on their daily lives, they see us going into level 5 and they're saying, I've done everything by the book. I did nothing wrong. And yet there are other areas where there's been abuse of the system. So ultimately, for the public, and I believe speaking to the public, reluctantly, on balance, they want to fight this virus. But we want to do it in a way, Minister, that over the next 4 to 6 weeks, a strategy is put in place that the public understand, the public can buy into, that the metrics are there to show how we'll go to different levels, and that they can see that we're going to live with the virus in our daily lives, keeping the schools open, which is hugely important, getting the colleges back in a normal way, in some way, allowing businesses to reopen in some way. And many of them were able to operate under level 3, with great difficulty, but nevertheless. So, Minister, I want to know overall, give me what is your plan over the next 6 weeks. So by the end of the 6-week period, we're out of level 5, and what is the strategy for living with the virus so the public can understand it based on definable metrics, understandable empirical evidence that is a fully enhanced risk-based model for fighting this dreadful virus that has had a huge impact on all our lives. Thank you.